Hi friends, this episode of the Cozy Lung Lounge is brought to you by Hootenanny Joy, where your health and wellness take center stage. At Hootenanny Joy, we know how overwhelming it can be to stay on top of your health, especially when life gets busy or chronic illness adds challenges. That's why we've created self-study programs designed to meet you right where you are. These programs are simple, flexible, and packed with tools to help you thrive. And they come with something extra, access to a live health coach. That's me, to guide you every step of the way. Whether it's improving your sleep, learning to nourish your body, or managing stress, our programs combine proven science with practical, real-life strategies. You can work at your own pace, get the answers you need during coaching sessions, and feel confident you're making progress. Ready to take that first step? Visit hootenannyjoy.com to explore the programs and choose the one that fits your journey best. Hootenanny Joy, because your health deserves a little joy. Hey everyone, welcome back to the Cozy Lung Lounge. Today we've got an unusual topic. It's still pulmonary, but it's pulmonary hypertension. We're going to talk a little bit about the causes, what you might find, warning signs, and what we're going to do to help take care of that. I'm Gina Hoots. I am one of the coaches here at the Cozy Lung Lounge. I got my wonderful colleagues here.
Hi, everybody. Kelly here.
Hey, everyone.
Now, we're going to try to make this complex topic on pulmonary hypertension a little bit easier for everyone. Really the basics, what is pulmonary hypertension? Hypertension, you've probably heard that with your blood pressure. That's your systemic hypertension. The pressure is high outside of your heart and lungs. When you get pulmonary hypertension, it's in your lungs. The vessels that are in your lungs are having high blood pressure. That's a pretty confusing topic, Amy and Kelly.
Well, it's easy to measure your systemic blood pressure. You go to the doctor, they throw a cuff on your arm and they can tell you what that pressure is, but it's a little more difficult to measure the pressures that are inside of your heart. And because it usually happens in the vessel that's coming from the heart going to the lungs, it's pulmonary hypertension because it's part of the pulmonary artery, which is really coming off of the heart. So it's not a lung problem as much as you think of COPD or asthma or those things, but it does affect the lungs and it does affect the oxygen levels. And that's why people with pulmonary arterial hypertension get very breathless as soon as they try to do anything. But it's not really a lung problem per se.
This is a hard one to exercise with. It's kind of tricky, but I think this is another example of why people need to be so conscious of your heart and your lungs. They are very intertwined. Sometimes having a heart condition can make you very short of breath. This is one of those where the two of them are really intertwined, but sometimes people don't think about that as much. And I know we've talked about instances where people may have a heart condition that makes them feel very short of breath. So this is an interesting topic today.
Now, there's 5 different categories of pulmonary hypertension. Has to memorize any of this. I don't have it memorized. I often look at my resources for this. But the classifications are largely driven by what is causing the pressure increase. So, for example, group 1 pulmonary hypertension has been caused by something. We don't really know what. It could be idiopathic. It could be inherited. But you know what? It could also be caused by toxic exposure. You might have remembered years ago this fen-phen. It was a diet drug, but the diet drug really caused pulmonary arterial hypertension. A lot of people had a lot of problems with that. They came off the fen-phen, but a lot of times their pulmonary hypertension didn't go away. And that was really important for some of the research. So if you have a type 1 pulmonary artery hypertension, the disease is actually inside your pulmonary arteries.
There's also what they call group 2. And so this is more of a valve problem rather than a pulmonary artery problem. So the blood goes into your right side of your heart, sends it to your lungs to pick up oxygen, drop off carbon dioxide, and comes back to the left side of your heart. And then that oxygenated blood goes out to your body. And what happens in group 2 is the left heart has a lot of pressure because there's a lot of volume of blood in there that it can't push forward for whatever reason.
So then group 3 is with lung disease and hypoxia. So this is when a lot of times it's, especially when a pulmonary health condition is not managed very well, it can lead to pulmonary hypertension. So things like COPD or interstitial lung disease, sleep apnea. Sleep apnea is actually a big one that can lead to pulmonary hypertension, but all of those different things can eventually lead to the development of pulmonary hypertension if they're left unmanaged, not taking care of yourself, making those lifestyle modifications, and taking your medicine like you should.
Now, group 3, like Amy was talking about, has to do with vasoconstrictant factors. All of those things caused your vessels to constrict.
So I want to go back to what Amy was saying. Another factor is chronic low oxygen levels can cause the pulmonary blood vessels to constrict. So I'm talking to you people who sit with your oxygen on and then take it off to go to the bathroom or take it off to go to the kitchen. That's the time when you need your oxygen, is when you're active. That's when your body's activity is pulling that oxygen out of the blood. So if you let yourself desaturate down into the 80s, even the 70s, or worse than that, those blood vessels inside of your lungs are just getting smaller and smaller and smaller. So a good high level of oxygen will help to keep those dilated. I can't stress enough the importance of, especially if your doctor is hinting that you might have pulmonary hypertension, of keeping yourself well oxygenated.
Boy, that's such important for our audience to really drive that home. Oxygen levels are so important. And it just takes a $20 pulse ox from the drugstore to monitor that regularly.
And I know you think it's okay just to run to the bathroom and back and take it off and run to the kitchen and grab a coffee and come back. Just the smallest amounts of letting yourself get hypoxic, that has a cumulative effect over time. So please, please, please protect your heart.
I work with a lot of people like that who don't want to exercise with their oxygen on because they feel like it gets in the way. We do all seated exercise too. So I have had to work with them on finding different ways. I will drag a chair over to where they're exercising to have an extra chair for them to put their portable oxygen concentrator on. That is something that I deal with a lot, especially sometimes with men who want to do all of their things and they want to get up and move and mow the lawn and all of those things without having to wear their oxygen because it gets in the way. And they're like, I'll just put it on when I'm done. And I'm like, well, but when you're done, you're sitting on the couch and you're not using all your oxygen. So that can be a little bit of a challenge. Sometimes for people, it's a pride thing. But this is a really big example of how not doing those things and not having that good habit and that good lifestyle change can really impact your breathing over time.
No one wants to be on oxygen. We get it. Nobody asks to be on oxygen who doesn't need it. We understand. But the importance of it, we just can't drive it home enough. If you starve your cells and especially your heart of oxygen, you're going to be in trouble later on. Bigger trouble that we can't reverse and we can't do anything about. So please listen to your pulmonary rehab therapist when they yell at you to put your oxygen back on. Now.
Living with a chronic respiratory condition doesn't mean giving up the things you love to do. At Blue Zone Health, we're here to help you breathe easier and rebuild your strength. Our online cardiopulmonary rehab program offers tailored exercises, self-management training, and expert support from certified respiratory therapists. Accessible anytime, it's designed to reduce breathlessness, improve lung function, and empower you, all while connecting you with a supportive community. Visit bluezone.health and take the first step towards stronger lungs and a healthier future. Blue Zone Health. Breathe better, live better.
Okay, we've got 2 more groups in pulmonary arterial hypertension, group 4 and group 5. Now, these are things with a little bit different kinds of causes than we've talked about before. Group 4 has to do with blood clots in your lungs, pulmonary embolism. We want to keep those away. If you've got recurrent pulmonary embolism, there are treatments for that we want to make sure we keep track of. Group 5 is unclear. It could be a lot of different factors. It could be in your blood. It could be in your metabolism. It might just be inflammation in those vessels that are causing a lot of resistance to blood flow. So those are the 5 groups. You don't have to remember them, but you'll want to know the cause of your pulmonary hypertension if you can find it out.
The best thing to do is if you feel unexplained shortness of breath, before you just chalk it up to being out of shape or getting older, if you really feel like every time you move, you get really short of breath, please go see a doctor.
You may not be thinking of things like pulmonary hypertension, but there are treatments. We talked about oxygen for sure. But those warning signs, shortness of breath is the earlier one, dyspnea on exertion, so you can't walk as much. If you start getting more and more short of breath, you have chest problems, you're getting some chest pain, palpitations, that's increasing problems. And it may even be later stages, you have problems with that fluid moving around your body, and you have a lot of fluid retention and inability to really circulate the blood like your body is meant to do.
And even though we've been telling you it's not a lung problem, your doctor will probably send you for a spirometry test, because one of the things that'll do is help us rule out, okay, it's not your lungs and you're short of breath. Now we know where else to look. We'll start looking down a different rabbit hole to see if we can figure out what's happening. Is it just the pulmonary arteries or part of your heart?
So we've done the pulmonary function test. We've done a 6-minute walk test, and those are normal. And so we're going to do some more testing then to see what else might be the case.
You may end up starting with an echocardiogram. You may have to go in for something called the right heart cath, which means they go in and they thread a tiny little catheter, generally from a vein in your leg, and they thread it up and take it all the way up and measure the pressures going through the right side of your heart and out one of your pulmonary arteries.
I just want to just kind of mention in here, this all sounds scary. And just having a little bit of shortness of breath and thinking, yeah, maybe I have COPD. And it's something as crazy as this, where you're now looking at a heart catheterization. It's overwhelming. But the biggest part is that if this is something that you may have going on, and your spirometry comes back normal and your PFTs may come back normal, and they're trying to figure out why you have shortness of breath and they have to do that heart catheterization, it's so important that they do, because finding out the right diagnosis leads to the right treatment. So just in case you guys are starting to get sick on your stomach or worried about what we're talking about, please understand that as much as this is scary, these are very standard procedures now. That right heart catheterization is the gold standard for diagnosing pulmonary hypertension now. So please don't be worried. As much as this is a lot to go through, this is how we find the right treatment so that we can make that right diagnosis.
And a good doctor will start slow. He will probably do the pulmonary function testing or the screening, and then a 6-minute walk test, and then say, okay, we're not going to jump into a right heart catheterization. That's extreme. There's echoes, there's other things that we can rule out. But as I mentioned at the very beginning, we can't just put a blood pressure cuff on you and measure it. We've got to get something in there to measure your pulmonary arterial pressures.
Now, there's a lot of treatment options for pulmonary hypertension. There's a lot of new therapies on the way as well, because there's a lot of science going on. Number one, you always want to figure out the reason and try to reverse the reason that you're having that hypertension in the first place. Now, there's fun little medicines. People giggle. We can give Viagra for pulmonary hypertension because it opens your vessels, not just in one part of your body. It opens vessels in all parts of your body. What are some other treatment options that you guys have seen for pulmonary hypertension?
There's a couple of things. Some hospitals will have something, they used to have something called the Flowland Clinic, which is epoprostenol. And you go in and you sit and you breathe on what looks like a nasal cannula, but it has this epoprostenol drug in it. Sit on that for an hour or two, and then that will hold some people for a while. There's also a drug on the market called Ventavis, and it has its own little nebulizer drug delivery device. That's pretty easy to use, and you have to do, I forget, Ventavis every 6 hours. I think it's every 6 hours, and yes, you have to wake up and do it, or you did anyway. But your doctor will know what's the best thing. Once we can figure out what's going on, what group you're in, and try to figure out a cause, then we can figure out the best treatment that will work for you.
And when we're talking about, treatments, of course, I want to bring in exercise. But like I've talked about before, pulmonary hypertension isn't something that I've worked with a whole lot because it's just kind of a hard category to get into. But with pulmonary hypertension, you want to be very careful not to overexert with your exercise. And going to a cardiopulmonary rehab is one of the best things to do, to have that supervised exercise, and having healthcare professionals watching you the whole time, especially at the beginning. As you learn to manage and you learn to create your own exercise routine, you won't need that as much. But going in and doing low impact exercises, walking, very light strength exercises, we still want to continue to strengthen those muscles. And that also helps with training those muscles to use less oxygen, which puts less strain on your lungs. And then also doing some of that low impact walking to help strengthen your lungs as well. And it's also really good for your heart. So it's a kind of a harder one to do exercise with. It takes a little bit more focus from your healthcare team at a rehab clinic. But it's absolutely worth it to do that exercise and to do that supervised exercise, especially at the beginning, to have people kind of walk you through and teach you exactly what you need to do to not overexert yourself, but do everything that you can exercise-wise to improve your health.
A question I got asked a lot with people with pulmonary hypertension. They say, well, should I be in pulmonary rehab or should I be in cardiac rehab? I really think it depends on what the cause was and what group you were in. And if you have any elements of COPD, left heart failure, things like that, your doctor will know. But it's a good question to ask. If he wants to put you in pulmonary rehab, say, well, would I be better off in cardiac rehab or should I just go to pulmonary rehab? Both options are fabulous options and will help you exercise safely.
Well, and sometimes they're intertwined too.
Mhm.
And sometimes if you're not feeling so sure after your first round of pulmonary rehab about going to do it on your own, you can always have potentially a second referral for cardiac. So this is one where you just want to work with your doctor, with your pulmonologist, cardiologist. Make sure you get those referrals that you need and the referrals that you would like to get as much help as you need along the way.
Absolutely.
I don't know that we've ever talked in depth about pulmonary rehab and cardiac rehab. I think that's a great future episode in the works.
Absolutely.
Yeah, we could break that down. That'd be good. And as Amy mentioned, some places do both all together. Everybody's lumped together, but some places do have a separate cardiac from pulmonary rehab programs.
Pros and cons to both ways.
Mm-hmm.
Well, I hope that gave all of our listeners a little bit of insight into the pulmonary arterial hypertension diagnosis that you might see.
Absolutely. Well, thank you guys so much for joining us today. I think, this is a hard topic, but it's a really good one. And it is kind of a debate whether it's more cardiac or pulmonary, but like she said, I think it just depends on the group, but it definitely relates to your lungs and keeping them as healthy as we can. So I guess we'll just see you guys in the next episode. We'll be talking about emphysema next time.
Yes, we will. We will look forward to seeing you all then. Thanks for joining.
Bye, everyone.
Hi, I'm Kelly, a registered respiratory therapist with Blue Zone Health. Do you feel breathless much of the time? Are you unsure of how to manage your breathlessness? Is it keeping you from doing all the things that you would like to do? I'm here to help you learn to work with your healthcare team to come up with a plan that will work for you. There are lots of tools, tips, and tricks and breathing exercises that you can do now that will help you breathe easier and more effectively. I look forward to joining you on this journey and empowering you to breathe better.